Hi, good afternoon, and welcome to the podcast where we are exploring innovative and evolving healthcare models. Today, we're joined by Keri Rickenbaugh, a distinguished professional in the healthcare industry. Keri is the Chief Operating Officer at Concierge Medicine of Cincinnati. It's a practice that stands at the forefront of evidence-based primary care. Their unique approach focuses on providing personalized, insurance-free healthcare, allowing for a more comprehensive patient interactions than those traditional models. Concierge Medicine of Cincinnati is also part of the Miss Medicine Network, which further solidifies its commitment to high-quality care, particularly for midlife women's health. Keri has extensive experience in healthcare operations and management, showcasing her expertise in developing and implementing strategic initiatives that improve patient care and business efficiency. Her leadership at Concierge Medicine of Cincinnati is instrumental in their mission to redefine primary care. In our pre-podcast conversation, Keri shed some light on what she calls the car insurance analogy for healthcare, advocating for using health insurance for catastrophic events while really utilizing that direct primary care or concierge memberships for those routine maintenance. She also shared some exciting insights into growth opportunities in precision medicine, such as the use of the Gallery test for early cancer detection, while many traditional practices lack the time to implement these ideas. Today, Keri will delve into the innovative model of Concierge Medicine of Cincinnati, discussing how it removes insurance as a barrier to care and offers a more thoughtful approach to patient well-being. We'll explore the benefits of this model for both patients and healthcare business owners looking to adopt in this changing healthcare landscape. As always, we will discuss AI, how her practice is currently using it, and the potential it may play in both operations and clinical capacity. Welcome to the podcast, Keri Rickenbaugh.
Thanks so much for having me, Beth. It's a pleasure to be here and share the little bit of insight that I have.
Yes, well, we're all excited to hear. First of all, just tell us about your business there at the Concierge Clinic of Cincinnati and also the journey that you took to get there.
Yeah, so I have a pretty atypical journey to where we are. I've been working with our CEO and founder in some way, shape, or form for about 26 years now. We have been growing this kind of where we are today through several different academic practices, private practice, and then ultimately to our concierge direct primary care practice. I have a clinical background, knew very early on that I wanted to be in healthcare in some way, shape, or form, but kind of averse to the typical learning styles. I have a ton of on-the-job training, have finalized a degree in the past, and just continued to learn and grow with our broken healthcare system to figure out how to best provide the highest level of care.
And what would you say is your current largest struggle at the
Yeah.
Concierge Medicine Cincinnati at this point?
I think that patients don't understand how broken the healthcare system is, and getting patients to understand that good insurance doesn't mean good care.
Mhm.
Just because you have good insurance and they pay a large portion of it doesn't mean that the care that they are receiving is appropriate to the amount that's being covered. So really doing a lot of patient education. And some of that is just patients are looking for other alternatives. Some of those are patients are completely burned out. Their primary care provider can't see them. Their primary care provider isn't listening to them. So really just trying to get to the point where patients understand that there is another option that oftentimes can be less expensive than a traditional primary care practice.
I know, I think that is such an issue for so many people. Even if, like you said, we have, quote, good insurance, it doesn't always mean that we're getting the best care. And that's such a win in this day and age to feel like you even have good insurance, because that in and of itself is a struggle, good/affordable insurance.
For sure.
So that is something a lot of people are just starting to navigate over the past few years, this change that's happening. How do you then sort of educate patients, potential patients, on exactly what you just said?
Yeah. Well, I think the average primary care practice visit length is only somewhere between 7 to 15 minutes, most of the time 7 to 12 minutes, with only 5 minutes of that being provider facing. So you can hardly address why a patient is there, let alone have any thoughtful, proactive approach to any type of preventative or proactive healthcare. So I think understanding why patients are calling, they're calling for a reason. They're calling because they don't like their primary care provider. They can't get into their primary care provider. They don't have health insurance, and or they are just looking for someone who has the time and expertise to really provide to them the highest level of personalized care that we can. Most of the time, and this sounds like a sales pitch, but most of the time when we have a new patient calling interested in our service, oftentimes the first question is do you accept my insurance? Our answer typically is our model works outside of insurance. We really see insurance as a barrier of care. That being said, we don't work for your insurance, but we will help you work along with your insurance company. And really being able to explain to the patient that just because we're not submitting a claim to their insurance doesn't mean we won't help them use their insurance. And our model is a little unique too, in the sense that I think nationally, the concierge model probably does typically submit to insurance companies and direct primary care does not. In our model, it's one and the same. The way that I described it is if you kind of think of our practice as a plane and our providers are the pilots getting everyone from point A to point B in the most safe evidence-based way. It doesn't matter where you're sitting on the plane, you get to your final destination as safe as the rest of the other passengers. And your concierge membership is kind of like your first class ticket. You pay more, it includes more, and you have a higher level of access compared to the direct primary care model, which for us is typically managed by mid-level practitioners. And it's more like your coach ticket where you're not paying as much upfront, but you are paying for additional services, but only as you use them. So in our model, we really have lots of different options for patients and different budget-minded options with different providers. But the plane is the same. It's getting them as fast and as safe to all of the other or to the location as the rest of the other passengers. So for us, it's really trying to figure out what their pain point is. Is it cost? Is it time? Is it attention? And really explaining why our model can address whatever their pain point is.
And so while you guys don't bill insurance directly, can people utilize FSA and HSA funds with you?
Well, that's a great question. Recently in 2026, the federal government has allowed a portion or an up to a certain amount of dollars, HSA dollars, to be spent towards a membership. I think everyone is still trying to figure out or get their own interpretation of really what that means. In addition to not just HSA dollars, but we will help patients. We have several third-party vendors in our practice that can help bill to the patient's insurance. The lab vendor that we're using, the vaccine vendor that we're using, those are all services that we provide right in our practice that can be submitted to the patient's insurance company. And then along with prior authorizations for medications and diagnostic imaging, those are all things that my staff will work on the prior authorization for the patient to utilize their services outside of the practice.
I saw on your website that you guys have an option for a concierge for employers. So is this employers that would be able to utilize your services in addition to potentially a traditional health insurance plan that they might offer to their employees? Or is it instead of, or sometimes both?
No, it's typically in addition to. We would never suggest someone not have health insurance, but for employers who are really looking to reduce the cost of their health insurance to their employees, carrying a high deductible plan with a direct primary care or concierge practice actually makes a ton of financial sense for both the employer and the employee. So we're always looking for, they're most of the time smaller organizations. They have 15, 20 people that they want to be able to offer some type of healthcare. Sometimes that employer is also offering health insurance. Sometimes they're not, and they just can't financially afford that. And so those employees are getting marketplace coverage or even through a spouse, but they will cover the membership fee for the employee to and or their family members to be members of the practice.
That seems like an area for really potential, a lot of potential for you guys,
For sure.
actually, right there
For sure.
to fill that gap. And as any business, if there's an opportunity for them to give their employees better options and these extra perks and still save themselves money, then
Well,
that's a win for everyone.
for sure. And when employees feel better, they work better, right? So you really are
Mhm.
investing in your own team, and being able to offer same day or very next day and or virtual appointments makes a huge difference in their productivity.
And so that, yeah, that brings me to my next question. How much of your patient base is local? And do you have a telehealth component? And is that a large component of your current business model?
Yeah, I would say in concierge medicine of Cincinnati, it's 95% in person. We always offer the opportunity for virtual care. We do have a large population of what I would call young adult college students. So they call Cincinnati home, but they're not necessarily in Cincinnati all the time. We do have a membership specifically for them. So as long as they've been seen in the office once a year, we're happy to continue to do virtual care for them. Dr. Larkin, our CEO, does do a lot of virtual women's health consults. She's credentialed, I think, in 18 or 19 different states now. So she really has the ability to care for those people in a different way than most of them. But we
Hmm.
truly believe in today's healthcare with all of the telehealth platforms that are available out there that we can provide the best care for patients when we're putting our hands on them.
Yeah, that absolutely makes sense, especially like you said, for that at least annual checkup where
Yes.
they can get in and get that sort of stuff done. So we talked a little bit about the struggle, and the struggle is really just education for patients and the potential value. But what are some of the things that you're most excited about for your business? I would say in 2026, and then also projecting a little further, like into the next 5 years.
Yeah, great questions. I think the thing that excites me the most just about our care model in general is we're able to provide the highest level of personalized care. All of our appointments are 30, if not 60, and sometimes 90-minute appointments to have a very thoughtful conversation, making shared making decisions with the patients, talking about diet, exercise, nutrition, sleep, and just really looking at the person as a whole and having a much more proactive approach as opposed to a reactive approach, which is really what we've been seeing in a traditional primary care setting. I think the thing that makes us unique and I think is the biggest opportunity for growth is really we see both men and women, and we see 16 years old all the way up through the end of life is our commitment to midlife women's health, menopause, perimenopause, hormone management, bone health, sexual health, breast cancer risk assessment, and prevention, and really catering to these women who are no longer under the care of an OB-GYN, but don't necessarily, and they haven't really had a primary care provider, and they've been using their OB-GYN for strep throat or a cough, and really being able to give these women the time that they need to know that menopause is real, perimenopause is real, they're not crazy. There are treatments for them. There are, women's health menopause is kind of having its moment right now with the FDA black box
Absolutely.
warning and some of the newer medications that are coming out. But, well, I shouldn't say that. Many of the medications that are being used to treat men and women were only studied in men. And so we
Mhm.
have, as a medical community, have been doing a disservice to the female patients that we're using only male studied medications on. So really being able to advocate for women and advocate for treatments that were meant for women, I think is really where we will thrive in the next few years.
Yeah, I was wondering if you had seen a big uptick. I feel like there's so much more awareness, and I don't think necessarily it's just through my lens because I definitely fit that criteria of that demographic. And so I'm sure I'm seeing more of it, and all of my algorithms are feeding me more of that. Thankfully, I think of a friend of mine that I had that was older than me, and she was going through what I believe probably was a lot of these symptoms. And this was only maybe 15, 20 years ago. And so much of this wasn't even a conversation that she was having with a physician, with her friends, with any people. And I think of some of the struggles that she had that could have been alleviated if she had just been born 20 years later. I probably owe my mom a little bit of grace and patience, thinking now that she also went through that probably at a time when it was
Yep.
right after that big study came
Yep.
out and everything
WHI
sort of
study.
shut
Yeah.
down. Yes, yes, yes. So don't tell her I said that though, not yet. So the whole concierge style of medicine, I think, is really growing as well. Are you finding that physicians that are, recently coming up, are they more open to that style, or do they want more of a traditional style of practice, or have you even noticed a trend in that?
Yes, yes, and yes. I do believe the generation that is coming up has a different expectation of what a typical work life balance looks like. That being
Mhm.
said, I don't think they've been jaded by the healthcare system yet. And we are
Mhm.
seeing younger people leaving a traditional practice to look at ulterior practice options. And direct primary care has the highest a burnout rate right now. Primary care providers are
Mhm.
leaving faster than any other subspecialty. And what we are seeing typically is the direct primary care concierge model has typically been driven to a primary care only. In our practice alone, we've just added an endocrinologist. Our Ms. Medicine affiliates are now adding gynecologists. We're talking to other subspecialties just because this model may be the only alternative to not quitting, right? Like I'm completely burned out. I can't do it. I have to find another way to do what I went to school for and continue to pay off my student loans. And
Mhm.
this is the only way. And so, explaining to patients for a beloved physician who is really offering concierge level care in a traditional primary care practice, it just doesn't work. So getting those
Mhm.
patients to really understand, you can continue to see this provider, your doctor, or she's going to not practice medicine at all any longer. So
Mhm.
patients really kind of struggle to understand, what do you mean you've been caring for me for 20 years? How can you do this? I don't understand. You just want more money. And the fact is they don't want more money. They want better work-life balance. They want to be able to work for themselves. They don't want to work for the health insurance companies, and they want to see fewer patients and do a better job taking care of less patients.
Do you think there's a big change coming on the horizon as far as our whole healthcare system model? And also, if you do or don't see that, what do you think would be the best path forward in this quagmire that we're in?
I mean, that's a big loaded question.
I know.
And without getting into politics, I do
Mhm.
think the healthcare system is broken and or is breaking to the point of no repair. When you look at some of our, Canada, socialized medicine, I'm not sure that this nation is in a place to wrap their head around that yet. I'll be honest with you, I'm very worried about healthcare for my kids. I have, late teenagers, early adults, and I have no idea what healthcare will look like when they're my age. So with our current administration, I think that certainly adds a different level of complexity that we've never dealt with before. Yeah, it's broken. I think it's broken beyond repair, but I don't know what that means.
I think you're just echoing the fears of the majority of Americans,
Yes.
to be quite honest.
Yes.
But we're always looking for some sort of solution. It's got to be out there. We're going to be someplace 20, 30 years from now. And
Yeah.
what does that look like? Hopefully, hopefully that's the best place.
Yes.
So let's talk a little bit about AI. Do
Yeah.
you guys currently use AI either from an operational or a clinical perspective at this point in
Yeah.
your practice there?
I mean, I think everyone in my practice is using ChatGPT or Copilot or, who's Google using now? I forget the name of it. I'm not using it.
Gemini.
Yeah, Gemini. Yeah, I think everyone is, starting to dabble their toes in it a little bit. I've started using it a little more. We have been over the last probably 6 to 12 months really dabbling at what an AI scribe looks like. We're trialing a company actually right now that after 2 days, at least my experience with it in 2 days and supporting some physicians does look promising. I think patients are probably not sure what to make of it listening to their entire conversation and what that means. And I think AI is supposed to make life more efficient and workflows more efficient, but we all know that there's some training involved. And so the question really is are people able to invest the time and effort and patience to get it to the point where it really is helpful?
Yeah, and obviously with anything medical related, there's also HIPAA
Yeah,
concerns. So
privacy for sure.
utilizing in AI, your industry has sort of an extra layer of
For sure.
things to be considered. If you could automate something in your practice right now, that would be the most beneficial for
Mhm.
you guys. I think that would be.
I think the thing that would be most helpful, I don't think I'll ever do because I feel like it loses the touch points with the patients. There are so many AI phone answering systems where you can kind of use a bot to get the patient to the right person to help them
Mhm.
or
Mhm.
maybe even integrate to like schedule appointments. I understand that that's efficiency and I don't mind using it myself as a consumer. That being said, when you have patients who are paying out of pocket for a first class experience, I just don't think that
Mhm.
feels very first class ish. I think
Mhm.
the area where we would probably continue to explore is having, and this may not be AI as much as it is technology, but maybe AI. We're using several different platforms and having all of those different platforms integrated to themselves. So we're only asking the patient for the same piece of information one time and having that piece of information cross all of the different platforms. I have some providers who want patients to fill out a paper. I have some people who want to do an online survey. I have some patients or providers who just say, it doesn't really matter what they do in advance of their appointment. I'm going to ask them all the questions anyway. So I might as well only ask them once. So for me, it's AI, technology, and having some unity of how we are gathering and using information across the platforms.
That is one thing that I hear most often from the other guests that I talk to is integrating all of that so that once it goes into one place, it can just cycle through the rest and gets rid of that redundancy. And I know even just as a patient, it's so frustrating when you go in and they're like, please fill out this form again. You're like, but nothing's changed
Yeah.
in the year and I have to do it all over again. And it's just a short amount of time, but I feel that frustration myself. I do think that is where AI really shines is eliminating the need to repeat tedious tasks and certainly data gathering and analysis of that and anything that can be done to free up more time because a huge part of your model is that you're able to spend more time
For sure.
face to face
For sure.
with your patients. So
I just actually have one other thought on that too. I think
yeah.
the other thing is the sharing of information between facilities. So everyone knows Epic. Most people know Care Everywhere. It's this information highway of being
Mhm.
able to send and receive, mutual patient information, but they kind of own the monopoly. Epic owns the monopoly on getting that information to and from. And we're currently using I don't know, the second or third biggest EMR. And there is a health information exchange. It's not nearly as robust. And I do feel like our providers and staff are spending a lot of time tracking down information that if we were in Epic would be much easier. So I am sure there has to be some type of AI platform. In fact, I talked to a programmer probably 6 or 8 weeks ago and kind of a product that he was trying to build to have one information highway for all of the employee or all of the patient information.
That would be amazing.
Right.
I hope that comes to fruition for you.
Well, I do too. And he went to a venture fund, so I'm not sure it's going to.
Well, this has been really interesting. We've loved hearing about everything that you're doing there and the options and the just really the room for growth, not only for your business, but also to increase that level of care, which we are all struggling to find. I always like to ask my podcast guests one question. If you could be born with some God given talent that you do not currently have, what would that be?
You sound like my kids asking, what's your superhero power?
I always ask this question because I can't sing at all. And so I always know that it would be the ability to just really sing beautifully.
Well,
So for me, it's an easy one, but I'm always curious as to
well, that's interesting. I would tell you I'm a jack of all trade and a master of none.
okay.
I mean, I really go to superpowers. Maybe my kids have gotten me in there, right? Like supersonic hearing or
Yeah.
I don't know. I'm a decent cook. I'm a decent baker. I sew, I craft. I played all the sports. And maybe that's why I'm good in operations because I can multitask so well.
There you go. That's right. You're used to wearing a lot of
Yes.
hats and being very efficient at
Yes.
that.
Yes.
Well, thank you so much for your time today, Keri. I'm going to put the links in our show notes where
Great.
friends can find you guys. But what is the best way for them to find you?
Yeah. So our website, Concierge Medicine of Cincinnati.
Awesome. And you guys are currently taking new patients at this time and
We are.
plan to do
Yes, we
so
are.
in the
We are. You learn all about our providers on our website, all the social media handles. We're really trying to up that game and get some more engagement there. So we would love to see people on social or visit our website.
Okay. Well, thank you so much, Keri. Really appreciate our conversation and enjoy the rest of your week.
Great. Thank you so much, Beth.